Now we're moving on to the question and answer round. And we have so far one question on the chat. So I'd like to encourage us, if you have any questions, please feel free to post them on the chat, or you can also raise your hand and ask the question to the whole room. So the first question is from George, who asks, what are the presenters' views on unhealthiness of fresh produce? For example, the handling, hygiene, and production practices, so sewer water and chemical residues. And then there's another question from Hans, but this is around sharing of slides. I know the recording will be shared, but you can also see whether we can share the slides that have been presented today. So over to you, Michelle and Amos.
Maybe I could just answer the first question then, because it relates a bit to some of the findings in PhotoVoice. We certainly found a lot of evidence of concern for these issues, George, that you've just listed. Chemical residues, particularly in Kenya, we had a lot of concern about that, and environmental sanitation. I suppose, what can we do about it? We don't want to discourage people from eating fresh fruit and vegetables. So what we need to do is look at ways of trying to enhance the hygiene in informal markets and the environmental sanitation. So, if we look to the AfriFood Links project as an example, we have interventions being developed in Kisumu and in Cape Town, for example, that are looking at improving food hygiene, in Kisumu training food handlers, but also looking at ways that foods can be stored in better or cooler places, but also looking at infrastructure as well, trying to help, some of the things you say there, like the sewer water and the chemical residues require local government support. So yeah, trying to lobby for that as well. I don't know if Amos wants to add anything.
Yes, I totally, 100% agree with Michelle. As she presented the work in Ghana and Kenya, shared insight on some of the things that influence what people choose, not only on just the healthiness as we have it, but also the safety. And so in addition to the work that Michelle presented, indeed, Michelle's PhD student, Julia's work that looked at the systematic review on what is it that influences people with people's choices, identify food safety as a special, concern. And that is why, Michelle and I and others have been arguing that interventions in this space should not just be narrowly focused on restricting. In addition to restricting, we need to have measures that also valorize that which we want people to consume. If we want people to consume, fruit and vegetables, and they perceive them to be unhygienic, unsafe, they wouldn't consume even if they are available and they have money to buy them. So yeah, it's a very important, factor to consider when either assessing or designing intervention to improve food environment. That's what I would like to add.
Thank you very much for those responses. We have a few more questions on the chat. So there's one on what immediate steps can be used to reduce the huge space for unhealthy diets in shops before legislative measures are developed and enforced in the medium to long term. And then there's another question around the role of participants or recipients. They seem to be passive. So the question is, how can we better assess people's preferences and the ways they actively navigate or adapt to their food environments? So perhaps you can respond to those questions first.
Okay, maybe I could start with the policy or legislation facing question. And it's an important question as to, it takes years to get legislation in place. And so the question is, whilst we are waiting for those laws to be in place for us to implement them, what, immediate or medium, term actions could be done by stakeholders to improve our food environment? And the focus is that which we have in our stores. An excellent question. And again, I would go back to our if then therefore framework, that we need multiple interventions. Just don't focus on the legislation. In addition to the legislation, you should focus on other things. The evidence that exists, classify all the interventions as their level of effectiveness. We do know that those high level, legislative or legal interventions are most effective in terms of sanitizing our food environment. But the others, which are probably not as impactful as laws, can still be implemented. For example, in improving the nutrition, food literacy of consumers could be applied in the meantime, whilst you are waiting for laws to be enacted. Once consumers have been, socialized on these matters and they have the agency, they can even advocate. Imagine having 1,000 people in the county or in the city boycotting a particular food because they feel that is unsafe. It can even be as impactful as the legal, the legislation that we are talking about. Food industry would respond because their bottom line is money, and their consumers are saying they won't buy this product because that product is not good. So that is one. The other approaches include what not only what is in the outlet, but where is the outlet located? And so even at the subnational level, you can have bylaws. So whilst waiting for national legislation, you can have a bylaw. And a bylaw in Ghana, we have district chief executives or municipal chief executives. They can quickly come out with a bylaw and say, we're not going to allow advert to be, mounted close to school. We won't allow vendors to sell sugar sweetened beverages within schools. These can be done in the interim. And again, in Ghana, we are implementing what we call nutrition friendly school initiatives. They are not waiting for our national legislation to be out before they do. You have schools that are implementing policies to protect children from unhealthy food environment. So things like that can be done in the interim. Maybe I'll yield here and then Michelle can complement this or address the other question.
Yes, thanks, Amos. So I think it was Joachim, wasn't it, that asked the question about how we can better assess people's preferences and the way they navigate or adapt to their food environments. And obviously, the focus of our presentation's been more around the environments rather than those questions about preferences. But you're right to raise this because preferences emerge as a very strong factor in our research on an individual level, and how they, I suppose, when we think about the methods, which is, I suppose, what's behind your question in terms of assessing them, some of the methods are things like go-alongs and accompanying people whilst they're making decisions about their food choices, whether that's shopping or eating, recording these decisions and see how that interacts with food environments. This is not an area that I've got direct expertise in, so I can't give any of my own examples to illustrate that. I don't know if Amos has.
Yes, I don't think I have anything to add other than what you have said. But the approaches that are presented, right, were focusing on the social environment. Sometimes that assessment sometimes can be qualitative. And so apart from the observations that are talked about that can be intrusive, we rely a lot on perceptions. So what is people's perceived availability? What is their perceived access? Perceptions also on social norms. Like I said, we can ask children about whether or not their parent expect them to have healthy eating habit. approaches do they institute or rules do they institute at home to actualize that? So some of those things.
Thank you, Michelle and Amos, for those responses. We have a few other questions, and they're focusing mainly on methodologies and how to go about collecting information in food environments. So the first question is around whether you could share the start and end times of your daily survey activities. So the person is curious to know whether you encountered any food outlets that were closed during your initial visit, and if so, did you return at a later time? There's also a question on access to restricted areas, because as you know, at times conducting research in areas such as supermarkets can be a bit of a challenge. So the question around this is whether there were any strategies you used to gather information or data from these locations, or did you exclude them from the mapping exercise? And then a follow-up question on that is whether you could confirm whether you conducted full census of all the food outlets in the area. And then the other question still around measurement is which criteria did you use to classify foods as healthy or less healthy? Could you provide more insight on the framework or guidelines that inform that classification? And then on mapping activities, did they include weekends, such as Sundays or public holidays? And if so, did you account for potential variations in food outlet availability or operation during this period? And then also, could you elaborate on the categories of food promotion that you identified in your study? What criteria or bases did you use to define and differentiate those promotion strategies? So I think you can respond to that set of questions before we move on to the next.
Okay. Yes. So all these are methodology of method facing, and I presented on the method. Michelle presentation basically focuses on method because the approaches that we use to generate the findings she presented were also method. So I'm sure both Michelle and I can respond to some of these questions. Quite a number of them are related, so I will try to lump my response to a number of the questions. For example, on start and end times, whether a survey or a census, accessibility, I'm not talking about physical accessibility here. I'll try to respond to them together. The start and end time question is relevant because, especially in settings where we did our work, where you have outlet that are transient, you can have an outlet. If you are mapping outlet, you can have an outlet spring up at different times. And so if you get up in the morning and your start time is 8 o'clock and you go around 10 and you are done and then you leave, you are obviously going to underestimate the number of outlets in that given area. And so it is important for field workers to engage stakeholders within the area and have an idea how things work even before you begin the mapping. And so if you come to Accra area where I live, the local market, like I said, you can have a fruit seller, or let's say a porridge, we call it cocoa in Ghana, using the same stall in the morning. And then in the afternoon, it is a watcher seller, rice and beans. And then in the evening, it is something else. So if you are truly interested in getting a handle on the diversity of product and the outlet, you have to do this at different times. If you do it in the morning, your picture is going to be that, oh, here they are only cocoa sellers. But what about the watcher seller I talked about in the afternoon and then in the evening? So that is important. And then for either a census or a survey, depending on the goal, but also resources, right? If the geographic scope is huge and you don't have resources, including time, it may be challenging to do a census and then map out all. And so you may be able to take a sample. In that case, you are surveying. That would depend on the goal of your food environment assessment and then the amount of resources, including time, that you have. We have accessibility. We have encountered, actually yesterday I was online with field workers who are doing mapping or household listing, which is a census of all households in the geographic area that we have demarcated to do our study. This is a study that both Michelle and I are part of the Generation Age project. And the debriefing that I got from them included the fact that in very posh area, high SES area, you get there and then the people say, oh, they are high SES, and then they won't mind you. And some of them noted in their field note, docs. You are getting to a house and then not human beings will greet you, but docs, and you are scared to access. And so all these are important, considerations to take. But also in terms of communicating the findings, you have to, transparently document these and also report to them. If you say you are doing a census and as part of your census, because of these challenges, your census becomes a survey, that has to be, communicated. Because if 20% of the households are not mapped because of these reasons, that in truth is not a census, and that has to be communicated. Those challenges need to be communicated. Maybe I can yield here, Michelle, would address some of the other questions, and if need be, I can come back.
So, I suppose there was one question around how we classified the foods as healthy and unhealthy. So maybe I could just mention that. So in the study, the two studies that I was presenting, we also had a component looking at food consumption and most frequently consumed foods. And we used a combination of an energy density assessment and also nutrient density score that was created by actually a PhD student that Amos and I co-supervised, Zakia. And we produced this score, including 11 nutrients to encourage, because we were also recognizing the fact that in this context, some of the micronutrients need to be present. And then we included 3 nutrients to limit. So I think that was around fat, sugar, and salt. And then we classified foods on that basis and grouped them. So that's, but we also looked at other methods that other people have used to generally talk about foods which are defined as healthy and unhealthy as well. I'm not quite sure if I think Amos addressed all the other questions around methods and evidence.
Yes, thank you for those responses. We have another set of questions. One is on when analyzing a specific food environment, what methodologies or approaches are suited to identify the most plausible levels for intervention and to evaluate the potential impact. And then there's another question on bottlenecks that you have encountered when transforming food systems or conducting the food environment work that you've been doing, and how did you address or go about these challenges? And then the other question is on what can you say about roadside, street, and open air market food vending safety? And in addition to that, given the informal nature of food environments in Africa, are the methodologies that have been documented suitable for that particular setting, or is there a need to rethink some of the measurement methods? I'll give you a chance to respond to that set before we move on to the next.
maybe I could just address the question on the roadside markets and open air markets and the informal sector, or partly address that. So yeah, I think there was a paper that found that over 80% of food purchased was from informal markets. So yes, it's a very important sector in many African cities. I suppose in terms of what we can do about it, I touched on this a bit before in response to another question, but I think, as I mentioned, things like the training of market vendors, that's been very successfully implemented in Kisumu in the Afri-Food Links projects, looking at trying to support food vendors to enhance their infrastructure, for example, providing sanitation and clean water for market traders to use. I think that was one of the things that was requested in some of the other interventions in Afri-Food Links. That also seems like a key component. So it's really about strengthening what's there rather than trying to formalize it in a way that then is no longer adapted to the setting, I would say. And I think the method suited, sorry, I don't know if you're going to mention that, Imosia.
No, go ahead, please. Go ahead.
Yeah, I was going to say, I think what you presented is sufficiently generic that it actually includes these settings. It's about adapting some of those methods to a specific setting and their use. And in fact, there's actually there probably, it's probably the research in Africa that's leading the food environment research in other parts of the world, if you like, in terms of diversity of methods. So actually, many of these methods have actually been demonstrated already and emerged from within the African setting, I would say.
Yeah. Thank you. Yes. Yes. So just to add to that and to reassure whoever asked the question, as done elsewhere, when researchers from the global north and other settings are using methods that have been initiated or developed from other parts of the world, say Africa, they go through a process of adapting, validating, and so anytime researchers in Africa investigating the food environment take approaches applied in high income settings, we also try to adapt them to our context, and we can give examples. The approaches that Michelle presented that we did in Ghana and Kenya, some of them we had to go through a series of adaptations processes to ensure that they are fit for local purpose. If I had time, I could talk about the food epi work and some of the modifications that we made to it to ensure that and they are fit for Ghana and Kenya. I think there were two other questions. One on challenges or bottlenecks, which again I think is a very, very important consideration when you are planning to move into assessing food environment. But like I said, we don't end at the assessment. Once you have your assessment results, the ultimate thing is that we influence the environment so that you can have healthier food available, accessible, and affordable. And talking about that, some of the challenges that you face during the assessment, I think I talked about them when I was running to the earlier question. So I would focus on other challenges that you face during the policy development and implementation stage. And a cardinal bottleneck or challenge has to do with what I technically refer to as commercial determinants of health, right? When I was presenting, when you have certain actors within the food environment whose livelihood or bottom lines in terms of money making can be impacted negatively by a policy intervention that is health promoting. Those who are going to be affected or whose bottom lines are going to be affected sometimes don't think about the fact that it's for public health. They think about the fact that they would lose money. And they have multiple ways of interfering with the process. And so sometimes the way they do this is to also generate, counter evidence. And some of the evidence are not generated using transparent scientific approaches. And they will say, oh, you found out that 50% of the schools have sugar-sweetened beverages and kids are consuming it. They may, I don't know the approaches that they would use, but they could come out and say, oh, that is not true, 10%, just to dilute the conversation and so to sow seeds of, acrimony in the system. So that is one. If they do that and then they fail, sometimes they can even engage policymakers and, lobby policymakers. Oh, don't enact that law. When you enact the law, the rate of unemployment would increase because they are going to close our shops and then we are going to lose money. So sometimes politicians would tend to listen to them. That's why it's important for us as researchers, but also as advocates, to engage all stakeholders so that they are in the known that some of these policies have already been implemented elsewhere and some of the allegations being put forward by maybe industry actors may not be based on evidence. And then other times when the law is even passed, again, you shouldn't go to sleep. When the law is passed, that's not it. They can find a way of frustrating implementation. So it is an exercise that doesn't end. You don't end when you have research results. You don't end when you have a policy. You don't when the policies have been implemented. You always have to continuously, monitor and then respond. My advice would be that sometimes we recommend that we address some of those, oppositional arguments preemptively before those actors even come and say this doesn't work. You have already told the population that this is the evidence, and anytime you hear that it doesn't work, be advised. This is the data that it works. Something like that. Over.
Thank you very much, Amos and Michelle, for those responses. There's a follow-up question, but I think you have addressed it to some extent, still related to policy. So the question is on what advice you have on how to have policymakers committed and on how to bring them on board in this direction. And also, how did you manage to have in Ghana that multi-level policy action? And then I'll ask a few more questions. There's one on lived experiences. So how useful or not are lived experiences in understanding sustainable and healthy policy entry points for food environments? And then there's another question on how do you approach cultural aspects in food environments? So are there specific measurements that can be used to when you're looking at or focusing on cultural aspects? And then there's a question on also like the humanitarian, rural, and dryland settings, where seasonality, informal food systems, and non-market access pathways like bartering wild foods or food aid play a dominant role. Are we at risk so the first point is how do you see these tools adapting to those particular settings, so rural, dryland, and humanitarian settings? And then the other question is, are we at risk of mischaracterizing food environments in this context by relying too heavily on market-focused frameworks?
Well, yeah, I probably can respond to two of them. And I do have an example with respect to, how do we get policy stakeholders, for example, committed. So I can respond to that first. It is not. It's a process. So it's a process, and it takes time. And so the example that I have from Ghana dates back over a decade, where a series of continuous engagement leads to an establishment of mutual respect, but also the value in the services that we deliver. And sometimes people deliver services for a fee. There are other times that we deliver services at no fee. We say pro bono. And so over the past 10 years, researchers have worked with policymakers in different, categories. Sometimes services are delivered and they are paid for. There are services that are delivered at no fee at all, although the researchers could charge. And as a result of those engagement, that mutual respect I talked about, have developed over time. To the extent that there were times, a project that both Michelle and I were involved in, what we did was, usually when we are designing studies, you have researchers as investigators. We innovatively introduced one of the, policymakers as an implementing investigator. And so from the Ghana Health Service, for example, this person came from the Ghana Health Service. And a competent person, yes, that happened to be working in program or policy. And so when that person became a member of the project as an implementing investigator, the data that we generated was not just generated by researchers. It was generated by researchers, but also some of the policymakers. So when it came to, using that data to influence policy, they saw it as data that they contributed to generating. So it was kind of, easier. The other argument that we make when we are, engaging policymakers is we are here to support them. Policies are developed by policymakers. Researchers, we generate evidence, but we go a step further to support them. We are not developing those policies, and we do invoke the fact that it is the responsibility of government to, protect, promote, and assure the health of their citizens. And they do that through policies, legislation, strategy, and so forth. And so we are just here to provide a service. So that is number two. The third one that we found really relevant in this regard in Ghana has to do with addressing, age-old problems that militate against developmental policies. So data poverty, for example. If you don't have local data to use as a basis to motivate the policies that you want them to develop, that can be a very serious challenge. Then advocacy. Sometimes you have the data, but you need civil society to work with you to advocate for those policies. So we formed coalitions, which sometimes we say a coalition of coalitions. And these coalitions include researchers trying to do advocacy and advocate trying to ensure that their advocacy is evidence informed. So it is not one thing, but a couple of things rolled out over a long period of time to get to a stage where you have policymakers actively involved and are interested in developing policies that protect everyone, including those policymakers. So maybe Michelle, you can come in. I will come back later to address the second question.
Thanks, Amos. Yeah, so I suppose two of the questions are a bit related around the cultural aspects, but also the lived experience research as entry points for policy. And I was thinking, really building on what Amos just said, that it's a process. And I think one piece of the jigsaw to help that process and to help provide advocacy is doing lived food environment research, whether that's doing photo voice or ethnography, so that you can take the people's lives to policymakers, I think is really important. And I have one example of that actually when we did our project that I described, and we had a photo voice exhibition in the local community, but we also brought that exhibition to the national stakeholder event in some nice hotel in Nairobi. And I can just remember at least two of the policymakers coming to me and saying, we didn't know people lived like this in Nairobi. And these are people, Nairobi residents. And so I kind of thought that made me feel like we'd done part of our job, which is bringing people's voice to advocate, because it's understandable people are living in parallel spaces, aren't they? Not necessarily living in the same world in cities where there's a lot of inequality. So I think that to me shows the value of that lived food environment research, is trying to raise the profile of, to get people's voices to those higher levels. And I suppose the cultural aspects are part of that. And this relates again to co-design work that I think Amos alluded to, actually co-design of policy, but also co-design of interventions. And that's what we're doing in our Generation H project, trying to develop and co-design interventions to improve diets of adolescents, and taking into account their lived food environment and experience with diets, as well as physical activity. So yes, I'm afraid I don't have an answer to the question about dry lands and food aid. I don't know if Amos is able to, but I realize we only have 1 minute left of the
Okay.
meeting.
Yes. Just
So maybe.
briefly, I would just introduce something. Maybe the one who asked the question about mischaracterization can then, fetch and then study some more. I totally agree with him about the possibility of mischaracterizing food environment. Even when the tools are developed from within the same set, you can develop tools from within Ghana, and then if they are not applied properly, you can use it to mischaracterize. So there's this paper by Shana Dance and colleagues that they published in 2020. And what they said was that they argued that if truly we are interested in not leaving anyone behind in this food environment work, assessment, and then policy, there need to be a shift from decade of concentrating our work in the built food environment, right? Formal food environment to informal food environment as well. But I think the questionnaire, the person who asked the question is even drawing our attention to, humanitarian settings. That which you experience there would not be the same as in our normal daily routines. And so if you are using a tool developed for assessing things during normal daily routine to humanitarian setting, that would be a misfit. And so it is important for us to recognize that when we are developing the tools or when we are applying those tools. Yes. So recognize in addition to the natural food environment, the formal food environment, the natural food environment, built food environment, cultivated or farmed, and so on and so forth. So I think that is important. Since we don't have a lot of time, I yield now.
Thank you very much, Amos and Michelle. And to the participants for their active participation and for your questions. So I'll hand it over to Michael.